The war on COVID-19 is running into headwinds as it emerged today that 140 individuals, primarily from Eastleigh, Kawangware and Mvita, who tested positive for COVID-19 gave wrong contacts and cannot be traced for isolation. This means that these individuals could be moving around their communities unaware of their positive status, and if they are asymptomatic, then they could be infecting others unintentionally.
We have equally noted a cavalier attitude in some of the people in various estates, particularly here in Nairobi, where we've noted that people have thrown caution to the wind.
Although there is no data to aid in approximation of how far the virus could spread through these individuals, nevertheless, their actions could hinder Kenya's efforts to flatten the curve. The ministry also gave a breakdown of the status of all who have tested positive for COVID-19 in Kenya so far, after previous figures that they had given out failed to tally.
Further, to be able to avoid this in future, we have refined our template together with our partners to ensure that we are able to capture this information real time as the data is generated from the counties.
The ministry clarified that as of today, there are 671 people admitted in hospital, with 438 who have been discharged, while 62 have lost their lives to the disease. In addition, 140 who have tested positive cannot be traced due to wrong contacts, while another 130 are in isolation at home because of age or other high-risk factors, including some of the evacuees from India. Speaking to Citizen TV on phone, Acting Health Ministry Director General Dr. Patrick Amoth confirmed that patients from India who were allowed to isolate at home had to get clearance after a risk profile from their doctors was approved by the ministry. In addition, their homes must be well ventilated with a bathroom. No other vulnerable person can stay at the same address, and the ministry must be aware of their location so as to enable further consultations where necessary. This is a model Dr. Amoth believes will be the future of COVID-19 treatment, especially for asymptomatic patients. Another concern for the Ministry of Health is the upsurge in infections in Kibra. 49 cases confirmed today out of the 76 cases reported in Nairobi.
The high figures that we have been recording in the last few days are a function of two things. One, our increased sample size in terms of testing, and two, the fact that the virus is firmly in our midst and that we have established community transmission.
Kibra constituency is one of several in Nairobi that hosts a large informal settlement population and has been identified as a potential zone for lockdown, especially because of limited social distancing and heavy use of public transport.
Dr. tell me this. The president recently hinted at substantively reopening the economy. I want to know from you what medical data would inform this reopening. For example, in New Zealand, we know they began reopening after 3 days of 0 positive cases of COVID-19. On June 6th, Kenyans are waiting to hear from the president. What medical data would determine what decisions he'll make?
We have been working with our modeling teams, the combined University of Nairobi, Jomo Kenyatta Strathmore University teams, and they have come up with parameters, and it would be premature for me to share that without the authority of the chair of the National Emergency Response Committee.
Reporting for Citizen TV, I'm Waihiga Mwaura.